Greetings to everyone. I'm called Tongwa Gilit Kanyi. I'm a student a probably heard master student from the Biaka Institute, University Institute of Boya. I'll be talking today on stroke and its risk factor and how we can prevent stroke in our community. Stroke, it is a life-threatening condition that happens when part of the brain does not receive enough flow of blood. And here we have two types of stroke. We have hemorrhagic stroke, you have ischemic stroke, and we also have what we call transient stroke. With ischemic stroke, it is all about the blockage of the vessels that supply blood to the brain. And when there's a blockage, you'll be limited or drop in oxygen supply to the vital organ to the brain that nourish the brain, and there'll also be a decreased supply of minerals to that brain also. And we have the other one is called hemorrhagic stroke. With hemorrhagic stroke, is all about rupture, box, when there will be a flow out of blood out of the vessels or the blood that will be now we say cerebral or subcutaneous, so arachnoids. So with stroke, the risk factor stroke is also known as a non-communicable disease, and it's also known as a cerebrovascular accident. What I call cerebrovascular accident is all about what? Cerebral is all about the brain, the vessels that supply blood to the brain, and accident all about the injury that occur to the vessels that supply blood to the brain. And now, with the cause, it's not really known, but we have other risk factors that can lead to what we call stroke. Like example, we have prolonged high blood pressure, we have what diabetes, we have high cholesterol level, we have consumption of alcohol and smoking. Also, age have also scientifically they've discovered that age 50 years, people 50 years of age have a risk of having high blood pressure. So how can we prevent high blood pressure in our community from it to occur in our community? We can just convert our risk factor in a modem on how to prevent stroke in our community. How can we do that? The first one I talked about was what we call high blood pressure. With high blood pressure, if we can do frequent control of our BP and educate on the diet consumption, like reducing the consumption of salt, we can see how we can prevent stroke. Secondly, we can also see diabetes. If we can control diabetes in our community, early screening, we will do screening and taking our drugs and taking our diet that's related to our health condition. We can reduce the risk of having stroke. And we also talk about alcohol consumption. If we can quit out of alcohol, we can do sensitization, communicate the community that alcohol is a risk factor to stroke. Cigarette consumption is also a risk factor to stroke due to the component that build up cigarette consuming. We also have what they call high cholesterol level. If you can check your cholesterol level once a month, you reduce the risk of you having stroke in future. And also, if you can do all these things with your age, you will not be have high blood stroke in future, because I said this, that age also is a risk factor. Above 50 is a risk factor for you to have stroke. But if you control all this now, you will not have stroke in future. So if we can all join our hands together in a community and see how we can prevent this stroke in our community, it will be very better and very important for us. Please, thank you very much for your time. Help me and pass the information across, and we'll see how we can cross our hands together and see how we can prevent stroke in our community and in our country. Thank you very much.